I can confirm the webcast has started, so you can begin.
Thank you, Marie, and welcome everyone. Simon, shall I go straight to you if you're going to introduce this?
Many thanks, Councillor Fairhurst. So this decision day is to seek approval for the awarding of a grant of £1,220,000 for a new inpatient drug and alcohol detoxification unit in Hampshire. We've worked collaboratively with lots of local authorities across the southeast and part of the southwest to set up a local detoxification unit using a grant that we all received from Public Health England. Alina, if I hand over to you to kind of go through some of the detail.
Thank you, Simon. So in February of this year, the government announced there was an additional 80 million to fund drug treatment in this financial year. One element of this funding was to look at increasing the capacity of inpatient medically managed drug and alcohol detoxification, recognising that there's been a national shortage of these services over the last few years. Certainly for Hampshire residents, the nearest specialist facility is either in Kent or Bristol. So with regards to the funding, each local authority in England received an allocation from Public Health England to enhance current commissioning of inpatient drug and alcohol detoxification activity. They were relatively small amounts, and it became clear quite quickly that to make better use of these resources, a collective approach was required. So Hampshire County Council led on the development of a consortium proposal with all local authorities across the South East, and also Dorset, Bournemouth, Christchurch and Poole local authorities. So in total, there were 20 local authorities in this consortium. The proposal that was submitted and approved by Public Health England was to establish a new 9-bedded medically managed detox unit in Fareham for £1.2 million commencing this financial year. It's proposed that this unit will be managed by the Midlands Partnership NHS Foundation Trust, who will provide the specialist substance misuse and medical oversight, working in partnership with Two Saints, who are a housing provider for vulnerable adults who have available premises in Fareham. In terms of financial implications, there's no requirement for the council to match funds any of this unit, and there's no additional budgetary expense required from the council's public health budget. However, the Central South Coast Consortium are already working collaboratively to ensure that sustainability of this unit continues once the funding finishes. This work, however, sits outside the conditions of the grant and is separate to and not a condition of the award of this grant. In terms of why it's important to have a unit in Hampshire, the impact of the unit will allow for better access locally to inpatient detox and improved pathways of care for really vulnerable and unwell individuals with complex needs. These unwell individuals will no longer have to travel independently for many hours to access this treatment option. And it's also hoped that there will be a reduction in waiting lists for Hampshire residents trying to access units in other parts of the country. So the award proposal, we're proposing that the grant is awarded to Midlands Partnership NHS Foundation Trust for the following reasons. Medically managed detox provision for the most complex of individuals is delivered by the NHS only. It's been agreed that the unit needs to be located in Hampshire to serve the residents living in the Central Coast area between Kent and Bristol. Initial market engagement with providers, including local hospital trusts, indicated that they were unable to establish a unit in the timeframes required. And the grant funding is available for 1 year only. And we plan to have the unit up and running by September 2021. So a large NHS provider with capacity and capability to develop a high-cost specialist unit in a short period of time is required. So there's an overview of the proposal. Are there any questions or comments?
Councillor Fairhurst, you're muted.
You're muted.
Quite right. The dogs were going off. Thank you. Sorry. We talked last time about it being allocated on bed days, depending on how much each authority was putting in. Can I just ask, what's the general length of stay for a resident in one of these units?
It would be 14 days.
That's fixed, is it?
It is flexible because obviously when a person actually goes into the unit, they will be fully assessed. So it depends on their medical needs. But normally for a detox, it would be that length of time.
Mhm. Okay.
I think, Lena, you're absolutely right. It's based on clinical need, the average, and then the main is 14 days. You're then detoxed. Obviously, there's then a need to kind of go back into the community and carry on your recovery journey. So it's kind of, this is the more intense period, which is generally, as Lena said, set to 14 days. But obviously, if there's a medical need to stay a bit longer, they wouldn't be just pushed out at 14 days.
Yeah, no, I'm glad to hear that, Simon. If when they do leave, and it's been the Midlands Partnership who've been looking after them while they're in there, are they then passed on to other local services? So there's no drop off where they then have to go and find them. There is a clear pathway back to local services for them.
Yeah, so the expectation would be that our community substance misuse services would be linking in with the specialist detox unit. So that's not just for Hampshire, but that's across the whole of the South East, really. So they would be linking into their local substance misuse provider to ensure continuous care.
Super, thank you. Councillor Withers, do you have anything to add or to ask?
How many, having had someone referred to you, how many times does someone get referred back to you again in your experience? Because locally, I noticed that some of the people we've had treated, they get back into the group of people they were with before, and actually that really seriously affects their long-term recovery. So when you're saying on 14 days on average, you must have some people that obviously have recurred treatment on a regular basis.
So
you're right.
Oh, go on.
I was going to say, Councillor Withers, so this is, I guess, one part of someone's treatment journey, and at the minute they have to take that in Kent or in Bristol. What we're saying is that's got to be local, but it's absolutely got to link into the local services so that actually their treatment continues and they're prepared for it before they go in, so that someone would carry on getting the support from the local community services and carry on that journey. This is the kind of intense bit of the medical detoxification that needs to take place, very supervised and very carefully managed, so that it's safely done as people come off their come through withdrawal.
And I know
sorry, just to add to Simon's point, sorry, apologies, Councillor Withers. I suppose it's just to add that actually the people accessing these units are very, very unwell and very poorly. So by the time they need to access this unit, they need 24-hour medical care. And there are other detox units available that have a lower level of support that are provided by other providers. So just to add that in.
Okay, so in the last sort of 2 years, what numbers are we looking at really concerning Hampshire compared to obviously the other counties that NHS organisations that we're involved with? Because obviously 9 beds is obviously going to be a commitment for the South Central. So our numbers in Hampshire at that critical level, can you give me some idea?
So we're still working through the bed day proposal in terms of how we allocate that across the South East, and I'm happy to share that with you once we've developed that. From memory, last year there was about 40 inpatient stays for Hampshire residents.
Okay, thank you.
Right.
And obviously the critical thing here is after the first year's funding is obviously getting the funding to continue. And do you have a working group that is looking at that sponsorship?
Yes, so what we've established is we have a steering group, which is representative of all the local authorities in the consortium. And we've actually got our first meeting tomorrow. And we've also got a project board, which is more the doers, really. So there's a smaller number of local authorities working together. So yes, we are looking at sustainability. And we have about half of the local authorities are already committed to funding through their detox budgets, whether that's through the local authority or through their substance misuse providers' beds, to continue this unit to run from next year when there's no more funding. But obviously that's outside of this funding agreement.
Yeah, thank you.
But yeah.
Councillor Carpenter.
Thank you, Councillor Fairhurst. Thank you very much. It's obviously a terrific project and addition to our services, and will be, I'm sure, greatly appreciated by people who need them. I just really was asking a question slightly aside. During the period of COVID in the last year or so, has alcoholism and drug use become a bigger problem in our area? I was going to ask Simon. I obviously I've read that it has become, and I know just locally that that's the case. I just wondered, you know, what the situation is really generally. Thank you.
Thank you, Councillor Carpenter. I think you're absolutely right. We're looking at the national evidence. Locally, it's quite hard to measure that at this point in time because of the way we measure that, but I would absolutely expect to see that going up. But that would be a whole range of, I guess, levels of problems. So some people may have just started to drink more at home and may be then kind of increased risk drinkers. Some people will have drunk more and require a more intense service, not even at this level of the inpatient detox, but we are seeing that. Our services have been open throughout the pandemic, not just online. We've done some face-to-face where required. We've really supported people to take a different approach to their drug and alcohol misuse problem and carry on their journeys of recovery. So yes, I expect we'll have seen more demand, particularly around the alcohol area, going forward.
Thank you.
Thank you. Graham, I can see you're on the call. Do you have anything to add?
No, nothing to add. Thank you, Councillor Fairhurst.
Right, and Dave, you're here as well.
No, nothing specifically to add at this stage. If there aren't any other finance questions, I'm content with the content of the paper and that the services are sustainable from within the public. The Hampshire services are sustainable within the public health budget beyond this year and beyond the grant funding.
Super, thank you. Right, well, in that case, I'm more than happy. This is a real good news story, and I hope we get some good news out of this. So yes, very happy to approve this. Thank you all. Right.